This is Dr. Lorenzo Norris, Editor-in-Chief of MDedge Psychiatry. We are very pleased today to have Dr. Rosmarin with us to talk about some very important topics, in particular as it pertains to denial and how we think about denial in this day and age. So, Dr. Rosmarin, thank you so much for appearing on the Psychcast today, and welcome.
Thanks for having me.
Dr. Rosmarin, whoa, there's a lot going on. There is a lot going on. As we're recording this podcast, it has been an incredible 3 weeks. It has been an incredible 3 weeks for our country as well as our society. And these weeks really have required everyone to process a huge amount of information, including things in terms of, what it is that they believe, what they are seeing, and just really how they're going to make sense of the world going forward. And we are doing all of this in the backdrop of an unprecedented pandemic in which, as of this recording, we are over 400,000 deaths with unbelievable, with a projected 500,000 deaths. We are dealing with, if you will, continuing challenges in regards to social justice, systemic racism. In addition to all of this, we are in the midst of, if you will, a significant economic difficulty. So to say that it is truly an all hands on deck situation for every single person in the country, and I would dare say across the world, but there is no one who is left out of this. And this pandemic and has affected every aspect of our life. With that being said, please, I really want to hear you talk to us about denial. And many folks, as they talk to their friends or their colleagues or something of that nature, they'll just like, how can someone think this? Or why are they thinking that? Or why are they saying that? And then the discussion can kind of devolve into some kind of emotionality a bit. All right. So can you give us a little bit of clarity in terms of thinking about denial? And why don't we start with, because definitions are so vitally important, why don't we start with what is denial?
Sure. It's a great question. First, I think what you're referring to is people who are denying the fact that there is a pandemic, denying the fact that there is a health concern going on, or that there's an even economic concern going on. People up until, I think, this week even, were denying the fact that there's a new president, about to take office. And I think primarily that's what you're referring to. And those are really great examples of denial, which is a cognitive and an emotional process by which we don't face aspects of reality.
Okay, a cognitive and an emotional process by which we don't face aspects of reality. Can you break that down a little bit further when we talk about those two processes, the cognitive aspect first and then the emotional?
Sure. In terms of the cognitive aspects, there are certain aspects of reality. There's certain features of reality that are, they don't jive with our current way of thinking. And we don't know how to assimilate them because life is complicated. And often our way of thinking is sort of this big and life is this big or even bigger. And trying to assimilate aspects of reality into our pre-existing ways of thinking can create pressure and tension. And one of the ways of dealing with that tension is to actually exclude aspects of reality entirely by denying that. The examples I gave before are pretty specific about that. People have a certain way of thinking about how the world should be. People have to have their freedom. We have to be patriots. We have to be able to stand for certain, American values, and having the concept that certain either health or political risks, if you will, exist it doesn't jive with their version of life, of the truth.
Right. Let's get into that in terms of reality and ground truth, because I think this is very interesting. And again, going back to that kind of what it is that we think about denial. What, if you could say, would be the difference between denial and maybe an overvalued idea?
Great. An overvalued idea is somewhat of a manifestation of denial. I think denial goes a little bit further, though, to the point that somebody really just doesn't even see the existence of that other concern. Without overvalued ideation, often clinically there's at least some level of insight. Like I know I'm kind of stuck over here, but there's something else going on. Denial is like, what are you talking about? Just doesn't exist.
Yeah, and I think that is when we talk about denial. I like how you talked about it. We think about it along a continuum, regardless of whatever your theoretical background that one might be using. In this particular case, I'll talk about psychodynamic psychiatry or cognitive behavioral therapy. And when I think about denial from a CBT standpoint, I think about selective abstraction, generalization, things of that nature. But denial is like when you actually are just done, like there's something in front of you and everyone agrees on it, and you're just denying the existence of something that is that has an objective reality. Now that we kind of talked about denial along that continuum and the cognitive and emotional components, I've always felt that, whether it's a defense mechanism or anything of that nature, things don't just pop up for no reason. Things don't just, the brain and how we evolve, we don't just plop things on obsolete things. There was a reason why we are able to do this. Can you talk to us a little bit about what maybe are some adaptive aspects of denial that we haven't really thought about?
Sure. I think you're 100% right. Our brains go to a place of denial for very good reasons. And in fact, there are many manifestations of denial that I think are extremely common and happen on a day-to-day basis. I don't know about you, Dr. Norris, but have you ever done anything that you regret in life?
Absolutely. All the time.
Me too. Join the club. And sometimes those really don't work with our conceptualization of who we are. And for a period of time, sometimes people have to get a certain amount of distance from that. Obviously, that's not a good long-term solution. And that's when denial can really be problematic, when this occurs over the long-term trajectory. I guess it's in its sort of, greatest term would become almost psychotic when somebody's literally disconnected from reality in a certain respect. But that period of denial can sometimes be helpful. It can sometimes enable us to get the mental capacity and sort of to reset a little bit so that we can face those aspects of who we are and who others around us are.
Yeah, I would agree with you. And I think it goes back to, in regards, when we think about denial and the amount of psychic pain at times that we can encounter in our lives, or things that just, either there is a cognitive dissonance, if you will, between how we perceive something and then what it is. And that denial can, in a certain aspect, depending on how one uses it and your level of insight, frustration, tolerance, insight, and judgment, it can give you a moment of pause or a breather. What I think about, and I think this is fair to say, when we were witnessing the events on the Capitol, here, I'll throw my hand up with this. I actually was in denial to the seriousness of just what it was, even though that there were images there. And yes, I was like, okay, this is happening. But it took me a while and more information to fully process the extent of what was occurring and what I was seeing. And for me, this is fascinating because I've had conversations with my colleagues and my friends, and I've seen what you talk about, that distance. I've seen our stance on it change as we've gotten time. And I reflect back, I'm not sure how I would have responded if I would have had like full awareness or appreciation of what was going on in the Capitol, which current evidence certainly suggests that there was a plan from some, a coordinated effort, and again, certainly an assault on the Capitol. I'm not sure how my mind would have processed that if I didn't have some level of like denial about what was going on, that I thought, it was just protesters, like really. Well, I actually didn't think that. I thought it was always a serious situation, but I did not know how serious.
The gravity was a degree of the gravity was missing. I would agree with you. You mentioned something important, which was that you gained knowledge, you gained information between then and now. I would probably argue one more thing. I don't know you that well, but just as a fellow human being, fellow traveler with you, we also gain time. And with time, that intensity can settle down, and then we can take in that new information. When our amygdala is firing, when we have that midbrain limbic system activation, our cortex isn't able to assimilate aspects of reality, and we really need to sort of settle down before we can take in what really happened and then make a more impartial judgment about it.
I agree with you completely on that. Now, leaving the Capitol, let's talk about the pandemic a moment, because this is interesting. And I've seen my own, if you will, level of awareness or denial fluctuate throughout the pandemic, to be perfectly frank. At the start, I still remember our dean of the medical school, Dean Bass, Barbara Bass. She had just started, and we were having a meeting, and she said, "Oh, well," and it was in, I want to say February. She's like, "Okay, well, this is probably going to be the last meeting like this we're going to have for a while in person." And I was scratching my head, and they were having, "Oh yeah, we're going to have to cancel all vacations." I was like scratching my head. No, this can't be. I mean, we've been through Ebola. Right. We've been through, no, what? We're going to be gone for like 2 or 3 weeks. And I thought about that, and I was like, oh my goodness, this is, and then when it occurred, I was clearly, because I still remember my family, they're like, yeah, we're still going to be able to go on vacation. I'm like, no, we're not. This is, right. This is here. At that point in time, I was absolutely ready. I'm like, okay, the pandemic is here. The pandemic is here. But then what I have noticed, and we talk about that amygdala firing, is that I don't necessarily know that I would call it denial, but you could certainly, even though I've treated patients with COVID, I've worked in the hospital, I've done all of these things. And some people call it COVID fatigue, but I still have to catch myself. I will act like we have not experienced like over 400,000 deaths. I have to really, I want to go back or act like at times, if I'm being honest, like this, I want to go back to the previous normal. But in terms of that denial, I've seen it ebb and flow. And I've also seen it ebb and flow in response to different developments, including the vaccine development. So please go ahead.
100%. As you were speaking, I was sort of thinking of some of my patients who have been trauma victims, and they've been through literally hell and back, things that I could never survive. And one of the ways that trauma victims often deal with this is by getting emotional and cognitive distance from that. If it was from, let's say sexual or physical abuse by a parent, oh, he really loved me. It was really, it didn't really happen. Like there are aspects of this. Sometimes this is how you have situations where abuse can go on for months, even years, without people reporting it, because it's just too intense. The possibility of it being real is too much for us to handle. And I can certainly relate to what you said about the pandemic. The first days, like, this can't possibly be. And I don't know if I would have been able to handle the reality right away. Yeah. Had I known it would be a year.
Yeah, exactly. If you knew it was going to be a year, some people were, for lack of a better word, early adopters. I remember one of my colleagues, Dr. Bruno Petino, who's medical director of GW Hospital. I remember early on, he's like, yeah, this is just a lost year in many respects. And I'm a psychiatrist, so I'm like, whoa, that's a bit aggressive, Bruno, but he was right. I mean, in certain aspects, in terms of whether you were, whoever's listening here, there were birthdays missed, there were graduations, there were different milestones that you are not going to get, if we're being honest, you weren't going to get to see again. So that kind of has the denial move back and forth throughout the year. But if somebody told me that this was going to be a year, who knows how I would have responded to it. But I wanted to follow back on something that you said, Dr. Rosmarin, and it had to do with trauma and how denial can protect us from trauma. I was talking to one of my colleagues in the hospital, and I was trying to get an idea of the mental health effects of the burden that all of our healthcare providers have been through, in terms of some of my different roles that I have in GW Hospital. And as I was talking about anxiety and depression, she shot back and she said, I'll tell you what you're forgetting. And I'm like, sure, what is that? Trauma. I'm like,
Oh.
almost, yeah, she, boom, like hit me like, woo, like cold Boston wind or something. I'm like, whoa, what are, or I'm from Northeast Ohio, so nothing's like worse than cold wind come off of Lake Erie. But that's how it hit me. And it got my attention. And I was just like, and you did the same thing when you said trauma, because again, maybe, look, it may be a long-standing denial thing for me in terms of trauma, but she was absolutely right. She said that many of, or the perception, I don't think it was actually that, but it felt like it, every patient she touched died. You know, in terms of COVID, that was her perception. Obviously, that was not the case, but who am I to argue with your perception? And I certainly will not argue with the trauma level event the entire country at this point in time has been through, whether it's due to loss or this, that, or other. So I just wanted to touch back on that, because I thought you, in terms of, there's a lot of things that people talk about with COVID. They talk about it in terms of war. They talk about it with this. We probably need to start talking about it in terms of loss and trauma. Please go ahead.
Yeah, I think it has been actually quite, in some ways, we've all been in denial this past year. Anybody who's faced some of any of the difficulties, especially frontline healthcare workers who, like you said, have literally seen their patients dying and, you know, wheeling them out, and that, you know, it's been horrific. You know, in some ways, the only way to handle the acuity of it in the moment is to get a little bit of distance and a little bit of separation from it. The problem is that it's not a long-term solution. And I think we're buying ourselves time, and we're still in the middle of it. So I think it's fair that we're giving ourselves that time to sort of just, you know, people think just keep on, carry on. Don't worry about what happened. Don't even think about it. But there is going to have a time where we're going to have to, any trauma victim, any trauma somebody's experienced, that eventually does have to come back into touch with reality and deal with it, because it will catch up with us.
It certainly will. Now, I want to hear from you in regards to denial, because we've talked about, again, denial along a continuum, denial at times being adaptive, denial being something that we've all experienced in some way, shape, or form or another, at times as a response to, all is a strong word, but I'm gonna go with it, in response to trauma, all right? How do we know when we need help or things have gone too far? And by we, I mean every single person, not just our patients, I mean ourselves, all of us.
Yeah, this is the problem with denial, is that when people get stuck in a place of denial, they're usually the last ones to recognize that they need help, because they're literally out of touch with the reality that they're facing. Typically, it's what they would call, what I should say, what we, because I engage in denial also. Typically, we know that we need help for denial when there are side effects, which are really main effects, that we're experiencing. You know, I'm thinking about the book, The Body Keeps the Score, right? Classic text in psychiatry, where people might have physical pains all of a sudden, or their body isn't functioning as well, and we're like, there's no medical cause for it. Like, what's going on here? They're usually, or relationships all of a sudden are not as strong and robust as they used to be. When people are missing out, even could be on economic opportunities. These are sometimes secondary to denial. And the primary reason for people to seek ends up being the primary reason why people seek treatment. There is a better path, which is relationships. Because if I'm connected to somebody else, that's another set of eyes on the situation. And that set of eyes will hopefully keep me in check, that I don't fall into denial.
I agree with you completely in regards to denial. And there's a better path in regards to relationships. It gets into problem solving through relationships, confronting very scary or difficult things through relationships. And as an example, when I think about, and I agree, denial ultimately is an avoidance strategy, which long-term, just it is going to be of limited benefit, if not potentially outright harmful. Let me use an example that I personally have been thinking of. So take a little bit of Lord knows it's very challenging to make political comments in this environment, but hopefully everyone will see my point with this one. And if you don't, well, put it in the comment section like folks always do. There's been a lot of discussion in regards to the validity of the current President Biden being elected. All right. And, how could people actually say that he was not elected? All right. What I would say, though, going back to what Dr. Rosmarin has put in our mind in regards to either one group denying the reality of the other group, I will recall that there were significant questions, and there have been, in regards to the previous, if you will, president being, if you will, elected. In regards, and I was in, okay, and folks, pile on if you want. I was there. I remember it. I saw it. So what are we, when we get into this, was this legitimate or was that legitimate or X, Y, or Z? Are we in denial because we're replacing one problem that we think is solvable with a much more difficult problem, which I think is, if you will, polarization? And how do we talk with each other, which is a much harder problem, in my opinion, to fix than saying that this person did this or this person did that. How do we talk with each other in a changing environment where many aspects of our world, and that was pre-COVID, were changing. And that's a frightening thing. And so that's when I think about, okay, and going back to what you said, how do I leave? And sometimes I view denial as you said, like, I'm only looking at half of the reality. How do I stop looking at my half and look at everybody else's half and engage in those really hard and painful dialogues? And in order to do that, you have to be, you better practice your mindfulness and your breathing, but it needs to happen or else we're going to keep staying in this. Please go ahead, Dr. Ross.
That's exactly, as you were speaking, is exactly what I was thinking, what you came to at the end. It's not fun to disagree with people, especially about powerful topics such as politics, as you've mentioned, or other similar topics. Religion's another one where people don't like to disagree with. The question ultimately, I think, when other folks are denying, the real risk is that we completely disconnect from the fact that we do it too. Everyone does this. This is a normal human response when people's reality isn't matching what they want to some degree. And if we disconnect from that relationship with people who are completely different, if that polarization gets to a point of not being able to speak to one another, then we actually end up in a greater risk for denial ourselves. Because I don't know what's going to be in 4 or 8 years. In terms of politics, I have no clue. I mean, nearly half the country voted for the incumbent president, who is now the ex-president. And we don't know what's going to be like, if in 4 or 8 years from now. Are we pivoting our? Is somebody of liberal persuasion, so to speak, a Democrat, positioning themselves for denial down the line if there's no discussion or if there's such polarization that nothing can be discussed?
Yeah, I mean, you just put something in my head. And look, I'm not a psychodynamic psychiatrist. I'm a CBT guy for the most part. But with that being said, I love denial, disconnect, and then denial again. It's a cycle that gets worse. One person 100%. Denies, then you disconnect, then you said the other person denies, and then that's going to lead to further disconnection. And that's a death spiral, basically. We will become, actually, very nice. I mean, I don't know. Yeah, please, like,
I'm more
tweet that out or something like that. Yeah, tweet that out or something, because that's the spiral. I think that's real. To me, that's real easy to understand, and it's applicable to my everyday life. And because it makes so much sense, because when we disconnect, we are hunkering more even down into our own beliefs and denying other valid aspects of reality. So yeah, I agree with you on that.
Right. I have many friends of diverse beliefs, politically, religiously, in so many ways. And I got to be honest, our conversations frustrate the hell out of me sometimes. They do. They're so obnoxious. How could you possibly say or think or believe that? But I'm not going to, but it's so critical for me personally, I'm speaking just from the heart here, it's so
Right.
critical for me personally to have those relationships, because otherwise I'm at risk for falling into the same vice very quickly.
It is. Tell us a little bit in regards to that. What are your own, if you will, personal strategies or techniques for dealing with, because I think everybody's going to resonate with that. I mean, people are having some rough conversations with friends,
Yep.
colleagues, or family members. I can't tell you
Yes.
how much family discord I have been talking with people about. What are some of your own personal techniques or strategies, Dr. Rosmarin?
We have to calm down when we're having these difficult conversations. Got to breathe. You got to regulate ourselves. Go in with the understanding that certain things about the person are just not going to jive with what we believe.
Mm-hmm.
And I think ultimately it means doing what's best for the relationship as opposed to what's best for our own beliefs. You know, we live in a country, in a society, I should say, that values independence a lot more than interdependence. And I think it's in some ways it's created a lot of strength because we have a lot of independent, strong, folks in the United States who are doing amazing things. But I think it's actually created a great weakness that our social ties and our relational ties are very limited to only people who see our way.
Yeah, you know what? Yeah, that only people that see our way are only things that confirm our beliefs, that confirmation bias.
Right.
Dr. Rosmarin, as you were talking, I mean, the things that I thought about just even in my own life, I mean, when a trauma level event or something significant happens, we have to work to acknowledge it for what it is. And then I like what you said, we got to calm down. Everybody calm down any kind of way you want. If you want to use breathing, fine. If you want to use mindful walking, fine. If you want to, I mean, I can't necessarily recommend binge watching on Netflix, but Netflix has a lot of good stuff. But the key thing
I was thinking a beer or two, actually.
A beer or two works. I mean, in moderation. Everything in moderation. Everything in moderation. But the idea that Dr. Rosmarin was teaching us is that we need to calm down. Then the next thing, I'm going back to those two things. It's amazing how just medicine and healing comes back to the same principles: time and distance. I have to acknowledge that I am not going to be as clear or sharp in the acute throes of a trauma event as I will with time and distance. And I was actually happy with myself that compared to other things, with the most recent, the attack on the Capitol, I actually did take that time and distance, and I thought I was able to engage in a much more good conversation. And then the other thing is when you come back, the thing I've been looking at is search at least for because that at least you can have a conversation. Let's start with the ground truth. One of the things that I have, for the majority of folks, seen, regardless of where you're at, people do not condone violence. No, that I think is, and by majority, I'm talking greater than 60%. And I think that's a fair place to start.
I would agree.
Yeah, I mean, and at least that gives you a starting point. Now, from there, it can go quite drastic, but violence, particularly as violence directed at the government, most people, I didn't say all, I said most disagree. And also most people would agree that they do not want violence. I would also say that most people agree that you have to listen to the voices of those that are suffering or in pain, regardless of what they look like. And to me, those are two basic ground truths. At least you can start a discussion. All right. And at least maybe come back to. Go ahead, Dr. Rosmarin.
100%. I was going to say, after calming down and chilling out, and also recognizing you're going to get jazzed, taking the time that you said, taking the time that you need in order to reprocess. And another key strategy here is validation.
Ooh, great. Go with it. Go. Yeah, I like that.
I don't agree that there should be, assaults on the Capitol at all. But there's some validity to a perspective. There's the right to bear arms. It is in the Constitution. Listen, I'm originally from Canada, so I'm like, in terms of gun violence, this is very strange to me. Like, I live here in the United States now. The fact that there's any right to bear arms is something that's very foreign to me personally, but it is in the Constitution, and the purpose of it is to make sure that certain processes are followed. So I'm not saying that I'm not condoning violence in any way, shape, or form. I want to be very clear. But if speaking to somebody about this, I could imagine myself validating and saying, hey, it must be really upsetting to think that there was, justice was not served, that there was tampering with an election, and you feel that the only way to solve this is through the right to bear arms, which is constitutional in nature to some degree. I get that. I still disagree. I don't think that was the right thing to do. I think that it's dangerous. I think that it's going to perpetuate not only potentially violence, but it's creating chaos and partisan divide that might never get, I hope it does, but might never get solved. But with that said, there is some validity to perspectives that I disagree with. And I think finding that nugget of truth and saying it settles things down a whole lot.
Yeah. And to all of our listeners, I want you to, if you're listening to this, I want you to replay everything that Dr. Rosmarin said, particularly the fact that
don't take me out of context.
Right. Don't take him out of context. He said that he is not about violence. But what he did say is, he said a lot of very, very important things, is that we have to fight at times we have to work to see the point of truth or validity of that person's perception. You don't have to agree with it, but this is for, remember what we talked about. A key out of denial is the relationships. If we say hunker down, so it can hurt. It can hurt. People listen to this podcast. I'm sure we might get some people but that's not, you got to listen to what was said. We're trying to find the validity in people's points of views, regardless of whether you're at it on the spectrum, because that's ultimately going to engage in dialogue and relationships. And hopefully over time. Dr. Rosmarin, you've given us a really, really, really engaging discussion in regards to denial. I mean, I've talked to a few of you guys, colleagues and people from the Boston area, McLean. I'm gonna have to get up there when this pandemic is done and
come on over.
Yeah, exactly. Have a beer or something like that. Yeah, something. Talk with you about, and you can help me if I'm still in denial. Like my thing with denial is that, okay, next year the Cleveland Browns are gonna win. I'm originally from Northeast Ohio. You're like, no, dude, it's not exactly. But see, at least you were honest. See, that's the start of a good relationship. You're like, Lorenzo, nah, not really, dude.
I'm not seeing it. I might be wrong. I've been wrong before.
Well, look, in Baker Mayfield, we trust. All right. But in any event, listen, Dr. Rosmarin, it has been a pleasure speaking with you. And sir, the last words are yours with what you want to leave with the audience.
Ultimately, we are all susceptible to denial. There are aspects of reality, there are aspects of other people, there are aspects of ourselves that are nasty. They're just nasty. We don't want to deal with it. We don't want to, we prefer to sort of cut it off and just refocus ourselves here, as opposed to broadening our relationships, broadening our horizons. I think when we do that, we run the risk of denial even further and potentially a lot worse.
All right. Dr. Rosmarin, thank you so very much. Hope to have you again back on the Psychcast talking about some other things, including denial. And listen, you have a very pleasant and safe day. All right.
Thank you. Same to you.